My name is Michael Allshouse, and I'm a pediatric surgeon at ETSU Health. I became a doctor because I think it was a good way for me to meld my interest in science with an ability to do things to help other people, and it also allowed me to work with my hands and my brain simultaneously. I always kind of wanted to be a jet pilot, but I'm red green colorblind, so I couldn't do that. It seemed like a pretty good second choice. I think my specialty chose me. I really think it was almost like an epiphanal moment for me. I was a general surgeon and very happy in training, and I did my pediatric surgery rotation at Oakland Children's Hospital in California. And I encountered a patient, a little baby that I took care of who had been in the hospital for quite a long time. And one day I went in to round on her, and she just lifted her arms up like to pick her up because she'd been abandoned in the hospital. So I started carrying her around with me, and I realized I had this affinity for children that I had never known before because I didn't have any of my own at that time. And I felt like, wow, this is what I was supposed to do. It just came to me like that almost. I think the most rewarding part of my job is taking children who have problems which could theoretically define their entire life and trying to make that so it's a secret. So nobody really knows that they have it, or they don't have to know unless they or their family tell them about it. So try to make people not defined by their disabilities. What I'd like for my patients to do, again, is to not be defined by their disabilities. I'd like them to have a chance to lead as normal a life as possible, help with, alleviate pain or suffering, and also try to instill with them the idea that they can do things, sometimes not limited by what's wrong with them, but by just their own expectations, and inspire them to do better. My ideal day at work is probably doing some complex congenital anomaly surgery in the operating room, and going home and spending time with my family. I actually think the single thing that makes me provide better patient care now is a lesson that I didn't learn in a lab or in a residency program or in an academic setting. And I learned it in my own home. I have some kids who've had congenital anomalies and have some special needs who have taught me amazing life lessons about how to be a better man and how to be a better physician and how to be more compassionate to people and to understand in pretty much a profound way, for instance, how much things like that can impact the family life and the life of parents. And I think that's my biggest, my biggest learning experiences come from my wife and my children. I think the people, the quality of the people and the type of environment, I think it's a beautiful environment. It's a beautiful place to live. But I think the people here are just really genuine. There's something about the people in this part of the South that makes it a good family place. And my family picked up immediately on that. When you move to a community like this and the first week you're on your block, everybody on your block stops by and brings you supper and invites you to go to church with them, you know you're in a good place for family. Hey, I'm Mike Allshouse, one of the pediatric surgeons. Thanks for choosing ETSU Health. We're so glad you're here, and we're happy to be able to do so much to help you.